It's my pleasure today to talk to you about the results of EV-301. I presented the data for the 24-month outcomes for metastatic urothelial cancer from the EV-301 trial at ASCO 2022. These data show that the benefit that was seen initially with enfortumab vedotin in the third-line setting appears to be maintained over time, and that the results confirm at 24 months what the primary analysis showed. The way the study was designed, the study was stopped at the interim analysis for a benefit in favor of enfortumab vedotin with a hazard ratio of 0.7 for overall survival. That interim analysis became the final analysis. This is now the 24-month analysis, which essentially replicated the same results, with the median survival being over 12 months for patients with enfortumab and a little over 8 months for patients receiving chemotherapy. Progression-free survival also was maintained in favor of enfortumab, and there were about 20% of patients at 2 years who have not progressed on enfortumab vedotin, higher than with chemotherapy. In addition, just shy of 30% of patients are alive at 2 years treated with enfortumab, compared to just shy of 20% if they receive chemotherapy in the third-line setting. And while these numbers are not as good as we'd like, I will say that I think these do represent a significant improvement compared to the historical data, where we feel that probably less than 10% you might expect to make it to third-line therapy and through third-line therapy. The toxicity profile of enfortumab was also stable. There were a few additional cases of adverse events of special interest, including rashes, but only 3 additional patients experienced rashes, and none of them were severe or life-threatening events compared to the primary analysis. And so it reinforces that the safety profile is largely unchanged from the primary analysis. We know that patients treated with enfortumab vedotin in the first month can experience severe and life-threatening skin reactions in a very small percentage of patients, and so that requires dose interruptions and dose holds, or even discontinuing therapy for severe reactions. And there's been a lot of discussion about that recently and how best to safe use the drug. But we have learned that in patients who are tolerating enfortumab vedotin over long periods of time, that we do not see significant additional toxicities like this. And so it reinforces that the activity of the drug is very similar to what we saw in the original data from the phase 3 trial, and supports the use of the drug in the third-line setting, with future studies focusing on earlier lines of therapy and potentially improving outcomes for patients with this new agent. Thank you very much.